It is likely in the Plab 2 examination you will be required to develop a management plan for a patient. This refers to any ongoing care they require, including treatment and investigations. In some stations, you will be required to formulate a management plan in agreement with a patient. In other stations, you will be required to formulate these independently before presenting them to the examiner. The GMC blueprint highlights specific areas where you will be marked. These include involving the patient in the decision-making, discusses management options with patients, gives each patient the information they want or need in a way they can understand in order to obtain valid consent, recognizes and responds to patients' ideas, concerns, and expectations, constructs a management plan and communicates requests or instructions to other healthcare professionals, considers the patient as a whole, respecting their individual needs, dignity and right to privacy, autonomy and confidentiality, explains options clearly and checks patients' understanding, seeks advice promptly when unable to answer patients' queries or concerns. Any management plan should be formulated with the patient at the centre. Always consider the patient's ideas, concerns, and expectations when advising, recommending, or deciding on future management. You must demonstrate respect for the patient's right to confidentiality. You must also respect the patient's right to autonomy, their right to make decisions about their healthcare. It is essential, when deciding on any management plans, to treat your patient holistically. This means treating the patient as an individual, considering not just their physical health needs, but the impact of any management plan on their mental health, social situation, family, occupation, cultural and spiritual needs. Good communication is at the centre of formulating any good management plan with the patient. Be sure to deliver information the patient understands. Explain the options available to them. Explain relevant risks and benefits. Ensure you check their understanding of the information you are giving them. Decision-making should be done by the patient and supported by you. You should encourage the patient to ask questions and recognize your limitations. If you are unable to answer a patient's question, then signpost them to other sources of information, or highlight you would find the information from a colleague or senior. It is highly likely you will be required to formulate and present management plans in the Plab 2 exam. Ensure these are patient-centred, considering the patient's ideas, concerns, and expectations. If required, ensure they are formed in partnership with your patient, after you have presented all the available options and relevant risks and benefits. Treat your patient holistically, and consider the impact of a management plan on them as a whole. Encourage questions and check the patient understands and agrees with any management plan.